Well, good morning. I'm Irene Oldfather, Director of Strategic Partnership and Engagement at the Health and Social Care Alliance. And this is Alliance Live today, and I'm joined today by John Scott QC, who heads up our Scottish Mental Health Law Review. Good morning, John.
Good morning, Irene. Nice to see you again.
Lovely to have you with us, and it's good to have a little bit of time today to kind of follow up on where we left off just over a year ago, I think, John, when you were beginning to put the review together and the advisory groups and so on. So you're now into your third interim report, which I think you published in July. Have you been able to get the reach and range of participation that we talked about that last time that you hoped for?
We have managed, I think, given the circumstances, very well. But the pandemic has obviously had a very serious impact on the country generally, but in particular, groups who were already disadvantaged or living in deprivation or discriminated against in whatever way, they have found the situation much worse than others. And frankly, a lot of the really key networks became about helping people to survive and to get through. But despite that, when we had the call for evidence last year, a huge number of individuals with lived experience, whether themselves or as carers, and also lived experience groups, managed to contribute and let us have evidence. So I was hugely impressed by the fact that people managed to do it as well as just getting on with surviving in such difficult circumstances. But I think it's fair to say that when the majority of, and sometimes your only ability to communicate with people is the way that we're communicating today, by comparison to the last time we spoke in May of last year when we were face to face. This doesn't work for everyone, and I think voices that I would like to hear more from, and we'll do what we can, is from those within the group of people who are affected by mental health legislation who also have protected characteristics. So some of those other minority groups, and to see the particular ways that some of them are impacted by the legislation.
Things are beginning to open up, and it may be in the next year or so there'll be more opportunities around that sort of community-driven approach.
I'm really hoping that's the case. I've already had some emails through from some of the groups that we'd had contact with before, some of the groups we'd had meetings with before, suggesting that we look for dates to do that. And although the opening up is slow, and understandably slow, that's something I'm very much looking forward to. I think, as with everyone else, that there's a limit to what you can do effectively when it's all Zoom meetings.
So just to come back again, John, to your interim report, which you published just last month, in fact, are there any key themes emerging? I mean, I know when we talked last time, you were very keen that you separated out things which could be done, you know, that didn't require changes in legislation, and that you sort of tried to spend a bit of time on the things that really required that legislative change. Are there any kind of themes emerging from the work that you've done so far?
Well, that was an important point, because in order for changes in legislation, we're looking at a wait of several years. We'll put in our final report next year, but it's likely to be a good couple of years anyway after that before any legislation is brought into force. So we were keen to identify areas of good practice that could then be copied in other parts of the country or tried in other parts of the country. The voice of carers, that's one where I think there was a strong sense within the carers community prior to our review that not enough attention had been paid to them, and that important decisions were being made without keeping them advised and without asking them, especially where with some individuals, what we're talking about now is trying to best identify what their rights, will and preferences are. I think we've done quite a bit on that, and the Communication and Engagement Advisory Group carried out the consultation about awareness of the role of carers within practitioners, and that some of the results confirmed, I think, what carers feared, so that there's more needing to be done, and a collaborative effort involving a group of practitioners, but carers, including, of course, unpaid carers, and that it's a team effort around the individual, as opposed to any one practitioner being involved solely in decision making, and the individual at the centre of it feeling excluded, but also those immediately around them feeling excluded too.
So one of the things, John, that we hear from carers is that issue of confidentiality feeling like a challenge and a barrier, when really what they want to do is often provide information that could be supportive, informative to clinicians and those taking care of loved ones, and they constantly talk about being dismissed and not being heard. So I think, as well as the legislation, there's something about the culture change. How do we raise that awareness amongst clinicians and practitioners as well, that the family and the carers are part of the conversation? And is confidentiality, in your view, does that have to be a barrier?
No, confidentiality absolutely is very important, and there can be conflicts between an individual and their carers, and so care needs to be taken to make sure that sharing is done in a way that the individual themselves, if they're able to express their views, is happy with. But confidentiality, in effect, should operate as a one-way street, so it might impact on the information that can be given out. It has no implications necessarily for what the can be shared with, what the practitioner can listen to. And absolutely, I mean, they may sit there saying, I can't say very much, but they should be sitting there saying, I want to listen. I
think the way you captured that, I want to listen, if practitioners could just think in those terms, I think a lot of these huge barriers between families, carers and clinicians and practitioners could just be removed. And it is that I'm not giving you information, but I want to listen. So maybe there's something we could take forward there. But one of the sort of key areas in your interim report is about the principles and purpose of mental health law and who should be covered by it. Could you say just a few words about that, John?
When we looked at the three pieces of legislation, so the Mental Health Care and Treatment Act, Adults with Incapacity and Adult Support and Protection, we thought that in terms of purpose, who was covered, it wasn't wide enough. And some of it, in particular, Mental Health Care and Treatment Act, was framed around regulating the use of non-consensual measures, and that was the kind of key part of it, and that's been a key part of mental health legislation for a long time. And our review had been framed, and it was framed, in fairness to the Scottish Government, within the terms of reference that I first saw, the initial draft, around more positive rights, economic, social and cultural rights, seeing the person as a whole, recognising that their problems with their mental distress or health were only part of it and may be caused by or exacerbated by, for example, housing situation and benefits and a whole wider range of things. So that was an important part, to see it as fully as possible. So in terms of purpose and who it's for, we in the interim report talked about it being for all people with mental disabilities. And there are discussions still to be had in relation to, for example, learning disabilities and the Rome review and the recommendations there, learning disabilities and autism. But we want it to be as wide as possible. What we want is to try and refocus things on the positive rights and on earlier intervention and how these things might tie in with, for example, a national care service so that we don't see as many people needing to be considered for non-consensual measures at all. And obviously UNCRPD tells us through the committee's interpretation that we should get rid of any discriminatory compulsory non-consensual measures. And that may be an ambition, but that's something that we can't, frankly, at the moment see an end to non-consensual measures based on how things are at the moment. So I think our work may, and you might want to come on to this now, our work maybe takes us on the next steps to see what we can see from the end point there. But at the moment, and even within the groups where some people are saying, no, the end of all non-consensual measures, that's what the committee says, that's what we should have. But there's also a lot of people, the voice of lived experience is also telling us, don't do that, that's frightening. The thought that we might then be left with no safety nets at all. And while I didn't want the non-consensual interventions in my life that I had before, they saved my life. So we need to hear all of the voices of lived experience, listen to them all, as well as reflecting on the reality of the services and the resources that are available. Now, we want to be ambitious, so we don't want things to be limited by that. But equally, we don't want people thinking, as a result of our work, all the safety nets are gone and you're on your own.
It is a tough balance, isn't it, John? Because what we tend to hear in relation to those sort of non-consensual measures are pretty much what people feel are horror stories. So it's interesting, to hear that there are other people who feel that saved my life, it was a safety net. And I suppose it's getting a little bit of consistency of approach around some of this. We hear a lot about people getting into situations that they then can't get out of. And I suppose that relates to compulsion and so on. We hear a lot about restraint. And, you do wonder in a modern Scotland, is there a place for chemical and physical restraint? And do we have enough safeguards in place to protect people in those situations? So I suppose those are some of the day-to-day things that people talk about in relation to their experiences around that. And I think it is going to be helpful to get that wider perspective and hear some different views and voices, while understanding that for some people, non-consensual measures has been a very, very difficult thing. So I suppose it's getting that balance right, isn't it?
While at the moment we can't see a point where non-consensual measures could safely simply be stopped, that then makes it even more important that where it's used only where appropriate and only in an appropriate way, so that the steps that are taken are steps that, as far as possible, even in a non-consensual situation, because it's not like there's bright red lines over things like that. Now, and a person may be able to take part in some of the discussions and the decisions about their own life, even in a situation where they're subject to non-consensual measures. But within that, there may be things that it's possible to have discussions with them about. Now, of course, there are people who aren't able to communicate at all, but it's not all or nothing. And back to that point about people listening, and there's too few practitioners of the sort that we need, of the numbers that we need in some of these key areas, and that then places serious pressure on those who are there. And if your workload is such that you've got maybe 20 people to see, inevitably that's going to impact on how much time you think you can spend with any individual. And a lot of the practitioners that we engage with and that engage with us are exactly the sort, I think, that you would want to see. If it was someone in your family, you would want to see them dealing with people who are thoughtful, who are very well informed in relation to human rights, who want to do the right thing. But sometimes we need to recognise the pressure that they're under, which can make it very difficult for them to do that, and to reflect that it's maybe not the best decision that could be reached by that group of individuals, but it's the best that they think that they can do in difficult and time-limited circumstances. So we need to create more space and time for those discussions, and preferably to move things as far upstream so that it's different practitioners and it's carers and others that can assist and avoid the situations of crisis coming about at all.
And I wonder, I'm just thinking as you're speaking about this, John, it seems to me that there could be a very strong role for advocacy within all of this. And I'm also thinking, as you're speaking, about the importance of regular monitor, audit and review in these circumstances. So I guess, those are the kind of safeguards around advocacy, that I want to listen, having time to do the job that you're given, and audit, monitor and review. And I guess that kind of package you would hope would provide the safeguards that would be needed within the system.
Absolutely. Advocacy and collective advocacy, we've been having a lot of discussions about that recently, and we're starting an accountability work stream to look at things like that, and also to look at the tribunals and to look at the Mental Welfare Commission. And unfortunately, there are places where there's no advocacy available, and there are places where there's some, but people aren't aware of it. It doesn't come up. So it's something that we've heard great examples of it being used, and used very well, and some of the advocates being absolutely fantastic at performing the role that you would want them to perform. But again, there's questions of consistency and availability there. So that is really important, Irene, yes.
I'm conscious of the time, John, and one of the areas that I did want to go on and ask you about is that general landscape that you're working within. And of course, there are the recommendations from the Human Rights Task Force. Derek Feely's work on the Adult Social Care Review with recommendations. And I guess you'll be looking at sort of complementarity and how you can look at and fit in and make sure there's consistency across that broad sort of horizon of what's happening in other bits of the world in Scotland.
Absolutely. I mean, we engaged with the Feely review and also with the National Task Force, and I was on one of the wider groups that supported the National Human Rights Task Force. I think a lot of these things are coming together in a way that's really helpful. If it's done properly, this could certainly improve things in Scotland. The National Human Rights Task Force, I think one of the advantages there was they came forward with very clear recommendations about incorporating into Scots law the UN CRPD and also the International Covenant on Economic, Social and Cultural Rights, with the right, including the right to the highest attainable standard of physical and mental health. So one of the things that we were looking at was the question of incorporation. And the good thing is they've made that recommendation for us. So we've moved on even before we finished our work. The National Care Service, I actually see that as really important as well, because especially when you're looking at the whole person and when you're trying to look at earlier things that we can do to stop people ending up in a situation of distress where non-consensual measures have to be considered, then National Care Service could be the way that, the main way of looking at that. So actually some of our recommendations are likely, I think, to overlap with things that are coming out of, obviously there's a consultation on that just now, which you'll be taking part in, and hopefully people watching this will be taking part in. So I think there's a nice timing and synergy, and that these things could all come together really well. Now, there are going to be resource implications. There's some areas of practice where we don't have enough people, but if we address that as we pull the things together, we might end up with something that looks at the person as an individual and sees them through their journey, including those difficult times where they need more support and where perhaps a bit more effort is required to work out what they themselves want and what's best for them, including in discussion with their carers and their families. So I'm hopeful that this will work well, and there's been some coordination there, and obviously the main coordination will happen when we finished our work at government level. But I had a really good meeting last week with the new minister in our area, Minister for Wellbeing, and he's well aware of that. And within government, I think there's recognition that this is going to cut right across different portfolios, and that they're ready to do the work that's needed for that. So I am very hopeful. We've got about a year left to finish our work. That's a really challenging timetable, and especially where we continued working through the pandemic. I think we did a lot there with the help of you, Irene, and your organisation, and others in the advisory groups. Obviously, we've got 2 reference groups now, the practitioner reference group and the lived experience reference group. And that's great because it means that some of the more focused thinking and ideas can be run past them, and that both of those groups have been considering the purpose and principles papers, which are summarised in the latest interim report, and they'll help us with that. And then there will be some more focused, more targeted consultation towards the end of the year, as we move towards, on a no surprises basis, letting people know what final recommendations are starting to look like. And you can maybe get glimpses of that at the moment, through to a point where there's various conferences over the summer next year, which will give us an opportunity for some further international discussions. So we're going to work with all of that, and with your help and the help of others. And I'm very grateful to you for this opportunity again to have another means of letting people know what we're doing, because there will be people watching this who haven't read the report, and some people who wouldn't be able to. There's going to be an easy read version coming out fairly soon, but we want as many people as possible to know what we're doing, because it's so important, and it's really important for everyone. Any one of us could find ourselves in a situation where we're touched by any one of the 3 pieces of legislation, or sometimes more than one of the 3 pieces of legislation. And those who've helped us don't just want something better for themselves. The humbling thing is that those who've contributed to the review want something better for everyone else, and for those that come after. And we've got a huge responsibility, which I'm very aware of, in something that's hugely important for them now and in the future, and we want to get it right. So thank you for your time today, Irene, again, and thank you for all your help, and thank you for the help you'll continue to give us for the next year.
Thanks, John. Thanks so much for taking the time to join us today to talk about this really important issue. And if people are interested, the Alliance, of course, is running a couple of workshops with yourself and your team, John, over the next few weeks, and we'll put up a slide with how you can get involved in that. But I think the final message from you is clearly, John, there's lots of time yet still to have your say, and you want to hear from people. So thank you very much.
Thank you again.